Hello, good day, Mrs. Mary Grace Obdulia O. Amok, RN. My name is Joshua Go from Bachelor of Science in Nursing, Level 3 or SM3. I am here going to perform the return demonstration of the cleansing enema. So what is this? It is the introduction or induction of the solution into the colon or the rectum of the patient via the anus to distend the intestine or to cleanse and sometimes to irritate the intestinal mucosa, which thereby increase the peristalsis and the excretion of the feces and flatus. Okay, so there are classification or different types of enema. Number 1, we have the cleansing enema. It is intended to remove feces using the variety of solutions such as hypertonic solution, hypotonic solution, isotonic solution, the 3 solution. Okay, and then for the carminative enema, the second type or the second classification, it is given primarily to expel the flatus. Also, it retention to introduce, also the other one is the retention enema, or it introduce oil or medication into the rectum and sigmoid colon so often and lubricate the rectum and anal canal, okay, to facilitate passage of the feces. And then the last one is the return flow enema. It is used occasionally to expel the flatus, just occasionally. So what is the purposes of this procedure? Number 1 is to relieve constipation or remove the fecal impaction of the patient and discomfort. Number 2 is it stimulates peristalsis and evacuation of the feces, and then resumes the normal bowel evaluation, and then also it cleans and evacuates the colon of the patient. No, it prepares patient for diagnostic procedures such as X-ray or visualization test. Also, it prevents involuntary escape of the fecal material during the procedure and during the delivery. And it also relieves abdominal distension and discomfort. So the materials that are needed in the procedure are, you need your enema can and clamp and tubing, lukewarm water, okay, and then also soap solution, that's with bed pan or commode, rubber sheet, okay, since here I sit in my patient, and then rectal tube or rectal catheter. Okay, so that's a rectal tube and the rectal catheter. You also need some lubricant, your clean gloves. You also need some tissue papers and IV pole. As a nurse, we are following the basic guidelines of the nursing process: assessment, planning, implementation, evaluation, and documentation. So for your assessment, going to assess and identify the type of enema which is ordered by the physician, okay, and its rationale, and also assess for the physical condition of the client. Also, you have to determine the client as bowel sounds, and then assess for the history of constipation like hemorrhoid, pericarditis, okay, and then also determine if the client will be able to assume and maintain a sideline or knee chest position, retain the enema solution. And then assess for the client's mental state, including the ability to understand and cooperate with the procedure. And also determine the presence of kidney or cardiac diseases that contraindicates the use of hypotonic solution. And then for your planning, you're going to plan carefully. The procedure would cause the client to evacuate moderate large stools while preventing trauma and embarrassment from the procedure. And make sure to gather your equipment and materials. So for the procedure proper, the first thing that we're going to do is to avoid cross-contamination. We're going to avoid these diseases by washing our hands and explaining the procedure to our patient, admitting that the procedure may cause some mild discomfort, that to avoid loss of helplessness and anxiety. And then also we have to prepare the solution, making that it is a certain temperature of the solution is lukewarm by touching it, okay, or by using with your hands. And after that, you have known that it is enough. Prime tubing with IV fluid, and close the tubing clamp. Make sure that the tubing clamp is closed, and then place the enema can on the bedside of the IV pole of your patient. And then lower that pole so that the enema solution hangs no more than 18 to 24 inches above buttocks. No, then you can provide privacy for your own gloves, okay, After we have done glabbings, we have to place a rubber sheet under the client. I have done putting the rubber sheet under the client. I assist now the client to the left lateral position with the right leg accurately flexed as possible if it is not contraindicated. Then after that, I am now going to lubricate 5 cm of the rectal tube. Then I am now going to place the bedpan on the bed within I easily reach it. Okay, then I will put the side rails on the side which is facing towards the client. And then we are going to clamp to avoid any backflow or splitting out of the solution. So after that, I am now going to gently spread the buttocks of my patient with my non-dominant hand, which I am going to show with you after that. Okay, and then I will instruct the client to take a slow deep breaths through the mouth. Okay, and with the dominant hand, I insert now the rectal tube with the rectum, which is directed towards the umbilicus, about 3 to 4 inches, and hold that in place within a non-dominant hand. And then if there's a resistance, it is encouraged that the internal sphincter asks now the patient to take a deep breath, then run a small amount of solution through the tube. We never force here the tube or solution entry. If instilling a small amount of solution does not permit the tube to be advanced or the solution is really flow, withdraw the tube and check for any stool that may have blocked the tube during the insertion. Okay, then now release now the tubing clamp. After release the tubing clamp, allow the solution to flow into the colon slowly, observing the client closely. If there's a cramping, serum ascites, or complaint of inability to retain the solution occurs, lower now the solution container and clamp or pinch the tubing of the few minutes. Okay, then we can now resume the installation of the solution. Administer all the solution or as much as the client can tolerate. Be sure to clamp only the tubing just before all of the solution leaves the tubing. Slowly now remove the rectal catheter and place the rectal tube in a disposable towel as you withdraw it. Make sure to encourage the client to retain the enema. Ask the client to remain lying down. Request the client to retain the solution for about 5 to 10 minutes. Then assist the client to defecate. Assist the client to sitting position of the bedpan if the client can do the bedpan. Okay, and then or commode in the toilet. Then remind the client not to flush commode or the toilet before nurse inspect results of cleansing enema. If the specimen of feces is required, ask the client to use the bedpan or the commode. Like this. Now the client is now using the bedpan or the commode. And then when administering enema to an incontinent client, after the rectal tube is inserted, have the client assume a supine position on the bedpan. Then the head of the bed, make sure that it is be elevated slightly to 30 degrees to, if necessary, for easier breathing, and the use of the pillows to support the client's head and the back. And in the next procedure, if the patient is administering a return flow enema, so in return flow enema, for a return flow enema, the solution, make sure that the solution is instilled into the client's rectum and sigmoid colon. Okay, then the solution container is lowered so that the fluid flows back out through the rectal tube into the container by pulling the flatties with it. So the inflow-outflow process is repeated. Make sure that it is repeated for 5 to 6 times. And the solution is replaced several times during the procedure. So I'm doing it 5 to 6 times. If it becomes thick with the feces of the client. And then after that, after you have done to repeat 5 to 6 times, assist now the client if necessary with cleaning of anal area. Make sure to offer washcloth, soap, and water to wash his or her hands. For example, I'm wiping the client with toilet. So if the client can do it, you make sure to do it. Leave the client clean and comfortable. Care for equipment properly. Then you can remove now disposable gloves inside out, and you can discard it properly after you have done everything. And then make sure always to wash your hands to avoid cross-contamination. Then after that, you now do the documentation, evaluation and documentation. So for evaluation, you're going to evaluate performed a listed follow-up based or findings to deviate from expected normal of the client. Relate the findings of a previous assessment data if available. Report the significant deviation from expected to the physician. If we have so, note for the color, consistency, and amount of the stools, returns, and then check for the condition of the anus and surrounding the areas. Also evaluate client's response and tolerance to the procedure and or any complaints or unusual findings. Then make sure to document or record the type of amount of the solution, like the length, time of the solution was retained, the amount of color and consistency of the returns, and the relief of the flatus and abdominal distension in the client's record. And then there are points to remember. There are 3 importance to remember in this procedure also. Number 1 is make sure that the elderly patients who are unable to retain enema solution should receive the enema while on the bedpan in a supine position. Number 2, if your patient is young children, you should encourage to assist in relieving anxiety and encouraging cooperation when young children requires enemas. And then the last is limit for enemas until clear. It's usually 3 times. Check for the physician before continuing with additional enemas because fluid and electrolyte imbalance can occur. That will be all. Thank you so much and God bless.